Hi, I'm Steve Ardire, advisor to MI10 and numerous other AI startups. The subject for today is augmenting human intelligence for healthcare is the next disruptive innovation. So as most of you know, healthcare is now probably the major sector experiencing the benefits of AI, and the pace is only accelerating. There was a study from CV Insights last year about what are the following technologies that will have the most impact on healthcare. They had blockchain, robotics, immunotherapies, and CRISPR, and 65% was in the bucket of artificial intelligence. And as far as opportunities for disruptive innovation, you had at the top at 39% was mental illness. I had a previous video on how AI can address mental illness, but second to that was cancer, diabetes, heart disease, and then asthma. So 75% of the medical staff, agree that AI has enabled better predictions in the treatment of disease. So, you're seeing the benefits of that to make more accurate, diagnoses, and that's a great thing to see. 60% of AI-powered medical staff, spends more time performing procedures rather than the administrative work, and this is freeing up staffers' time, right, where they can do more patient assessment, more planning treatment requirements, and spending more time, right, relieving some of the more mundane tasks is great. So what this is fostering essentially is a collaborative, system of care in many respects, where you can get faster access to patient data, all right, and then be able to drive positive outcomes faster. Now, most of the work going on today is in lower level AI, and what do you mean by that? It's called robotic process automation, or RPA. We know that there's a tremendous amount of waste and inefficiency that trickles down to patient care priorities, and RPA can help streamline business processes and reduce time spent on repetitive routine tasks. So, fighting clinical error is a key challenge, cited by medical staff. So by using RPA, you complete these tasks faster with less errors or no errors, freeing up human time spent on higher level work. However, RPA isn't just enough to totally transform the healthcare functions. You need to combine RPA with more sophisticated machine learning, natural language processing, deep learning, and then you can have more sophisticated use cases, turning it into more intelligent automation and getting into higher level AI patient flow optimization, better insights for complex issues. And then again, clinicians can better focus on applying the tools to improve diagnosis and treatment, which means more time with the patient. Now, a couple of high flyers in this space that I just want to call out because they're doing some wonderful work are Olive AI, which is using AI in RPA, but also some of the higher level ones. And they are on a roll right now. They just launched a new company called Circulio Health, built on the Olive platform, and they're on an ambitious journey to fix Medicaid to provide tech-enabled world-class care to underserved populace. The other call out I'd like to do is with Alignment Healthcare, which is an AI platform for Medicare, okay, versus the Medicaid, where that uses a centralized command center to identify needs in real time that allows care specialists to predict care before it's needed. So rather than just being reactive, you're getting on the front end of it. Now, all of this all sounds well, but there's still a lot of challenges, with integrating AI into existing systems. And that's essentially what MI10 can provide. For we group them into three buckets: hospitals, healthcare systems, healthcare educators and administrators, and AI company executives and investors. So we have a four-pillar, I did a video on this already, of assess, educate, advise, and transform. And this is what we're going to market with for our AI advisory services. And you can see more of that on the MI10 website with some of those videos sprinkled in. So thank you for the time today, and I'll see you soon again.